grab your red loop band. Again, that is your red loop band in the Uniquely Fit kit. Bring it around your wrist and come to stand and face me. From here, I would like you to take the arms overhead, pulling out on it, palms facing in. And you're going to cross your right leg behind your left, bending your knees deeply, pressing your pelvis forward, keeping a neutral pelvis, so somewhere between arching and rounding. And we're going to side bend to our left, holding it here. Inhale 1, breathe. Exhale 1, arching the upper back. Inhale 2, taking your focus up higher than eye level. Exhale 2. Inhale 3, bones of the big toes heavy on the floor. Exhale 3. Inhale 4, belly firm. Exhale 4. Inhale 5, shoulders plugged down. Exhale 5. Inhale 6. Exhale 6. Inhale back up to center. Lower the arms. Roll the shoulders for 5, 4, 3, 2, 1. Cross the left leg behind the right. Bend the knees. Push the pelvis forward. Inhale the arms up, pulling out on that red band. Brace your abs. Exhale, let your inner thighs pull back as you side bend. Arch your upper back with your belly firm. Gaze higher than eye level. Inhale 1, breathe. Exhale 1, chin up. Inhale 2, you can always turn the head down on the diagonal or up on the diagonal. Inhale 3. Exhale 3. Gaze soft. Inhale 4. Push the pelvis forward. Exhale 4. Don't allow the body to twist. Inhale 5. Exhale 5. And inhale 6. Exhale 6. Inhale back up to center. And take the arms down. Roll those shoulders back for 5, 4, 3, 2, 1. Coming over to the wall, bringing your dominant arm into a cactus position, twisting away from that arm. Taking the same leg as that arm back for a calf stretch, internally rotating the leg in the hip socket to get into the outer calf, pushing the pelvis forward, keeping your chest and chin lifted, low belly firm, plugging your shoulders down. Hold it here. Inhale 1, breathe. Exhale 1, expand that side body. Inhale 2. Exhale, lift up on the muscles that stop your stream of pee internally. Exhale 2. Inhale 3. Exhale 3, stay low in that front leg. Inhale 4, press into the bone of the big toe of the front leg. Exhale 4. Inhale 5. Exhale 5. Inhale 6. Exhale 6. Turning back to the wall. Let's bring the other arm up, twisting away from it, stepping the same leg, side of the body as that arm back, internally rotating the leg in the hip socket, driving the pelvis forward, lifting in and up on the muscles that stop your stream of pee, lower pelvic floor lift. Plug the shoulders down, widen your collarbone, holding it here. Inhale 1, breathe. Make sure you're not locking out the elbow of the arm on the wall. Keep it nice and soft. Watch out for shoulder elevation. Watch out for the chin dropping towards the chest. Keep it up. Gaze soft. Rotate and twist from your rib cage. Make sure that the hips are even. There's a tendency for your front leg's hip to be lifted. And that's partially because your hips are tight. But if you can think about your pelvis on each inhale, especially the front leg's hip, pulling down towards the floor. And your exhale, you can drive that back heel down as you brace your abs and lift up on the muscles that stop your stream of pee. One more breath here. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Inhale, turning to face the wall slowly, bringing the arm off the wall, stepping the leg in. Let's set up our slider discs. Remember, if you don't have slider discs, you can always use rags or washcloths, anything that'll work as long as you have hardwood or a smooth surface. The slider discs work on carpet as well, so they're a great investment if you're working with a carpeted surface. From here, we need our red loop band. Again, that's your red loop band. It's going to come above the elbows. I'm going to demo the first exercise. I inhale, prepare, pulling out on that band, coming into a sumo squat. I exhale, I do 4 walks, 2, 3, 4. I inhale, pause, pulling my pelvis down. I exhale, do 4 torso twists. 2, 3, 4. Inhale, standing up without locking the knees or elbows. And then I exhale, let my inner thighs pull me back into the sumo squat to repeat. Let's do it together. Here we go. Inhale, prepare. Exhale, inner thighs pull you back. We walk for 4, 3, 2, 1, we inhale, pause, pelvis grounds down, exhale from the torso, we twist, pulling out on that band. 2, 3, in the direction we just traveled. 4, inhale, we stand up without locking the elbows or knees. Exhale, the inner thighs pull us back and we walk for 4, 3, 2, 1, we inhale, pause, pelvis pulls down, we exhale, twist. 2, 3, 4. This is our first exercise. Set the red loop band to the side. Grab your blue loop band. Again, that's your blue loop band. Bring it around your outer thighs. So with the blue loop band around our outer thighs, we'll now grab our green Theraband. Again, that's your green Theraband in the Uniquely Fit kit. Holding it like you're holding a jump rope, holding the ends. Throw the center of it around your shoulder blades, taking it under the armpits, wrapping it around the knuckles with the thumb on the outside. I'm not so concerned about how you're holding this as you actually using it so that you can be aware of your upper back. So I want you to puff your back ribs in towards that green band, finding your upper back extensors, plugging the shoulders down, working on turning off the front of the shoulders and the chest. From here, let me demo the first variation. If you have knee or back issues, this is your variation. Leg reaches for 8, starting at 12 o'clock, 7, 6, 5, turning 2, 3 o'clock, 4, 3, 2, 1. Knee issues, you'll do 4 alternating leg reaches in place, still pushing into the bones of the big toes. 4, 3, fighting for the back ribs to press into that band. 2, 1. If you just have back issues, you can do alternating lunges, so taking it deeper while you're at 3 o'clock. Looks like this. Make sure as you're doing that, your torso doesn't pitch forward. Your back ribs are pressing and puffing back into the band. No knee or back issues. Here we go. All you need to do, 8 scissor legs. So I'll just do it turning back from 3 to 12 o'clock. 8, 7, 6, 5, 4, 3, 2, 1. Inhale, prepare. 4 reverse lunges. 4, 3, 2, 1. That's all it is. Let's do the variation that's best for you. So I'm going to call out the counts, but you're going to do the variation that's best for you. I'm going to do the one that's not for chronic back pain or knee pain, since I don't have these things. But if you need to modify with the leg reaches, please do. Here we go. Inhale, prepare. Exhale, 8, 7, 6, 5, 4, 3, 2, 1. Inhale, prepare. Exhale, 4, 3, 2, 1. Inhale, prepare. And 8, 7, 6, 5, 4, 3, 2, 1. Inhale, prepare. And 4, 3, 2, 1. So this is our exercise in the transverse plane. Set all the props to the side. Final exercise I'll demo. 8 cross punches traveling forward in the sagittal plane. Pausing on the same side, 4 oblique crunches. 4, 3, cactus arms. 2, 1, feet back on the sliders. Cross punches, side leg reaches. 8, 7, going backwards. 6, 5, 4, 3, 2, 1. 4 oblique crunches on the other side. 3, 2. Let's do it together. We travel forward for 8, 7, 6, 5, 4, 3, 2, 1. Chin up. Gaze higher than eye level. 4 oblique crunches. 2, 3, 4. Back to center. Inhale. And 8 leg reaches. Side leg reaches with the cross punches. Same leg as arm. 8, 7, 6, 5, 4, 3, 2, 1. 4 oblique crunches on the other side. Chin up. Gaze soft. Higher than eye level. 4, 3, 2, 1. Now these are 3 exercises. Grab a sip of water. I'm going to grab my red loop band, put it above my elbows, demo that frontal plane exercise one more time. I inhale, prepare. I exhale, sit back into my sumo squat. I walk for 4, 3, 2, 1. I inhale, prepare. I exhale, twist from my torso, not moving my legs or pelvis. 2, 3, 4. Inhale, standing up without locking my knees or my elbows. Then I repeat. Okay, get set up. Counting you in. Make sure when you pull out on that band, your shoulders are plugged down, counting you in. 5, 4, 3, 2, 1. Here we go. 100% effort. First set in the frontal plane. How hard can you go? How much can you give me right now? Push yourself. And it really helps me as I'm walking the squats to keep my knees tracking safely to pull my inner thighs back. So I like to brace my abs, tugging in and up on the muscles that stop my stream of pee, and actively pull my inner thighs back to the wall behind me as I walk the squats. Then before I do the torso twist, I inhale and feel as if someone's pulling my pelvis to the floor. So I sink a little lower and lengthen my side body. And then I twist in the direction that I was just traveling from my rib cage without moving my knees or my pelvis. Make sure you're breathing. You only have 20 seconds remaining, so please give me 100% effort. Try to not lock the knees out or the elbows when you stand up between your sets. This reset is important. So as I stand up, I feel my pelvis pulling down in opposition. I lengthen my QL, that low back area, and my obliques. And then I sit back, pulling back with my inner thighs so that they can guide me as I start my sumo squat walk. Counting you down. 5, 4, 3, 2, and 1. Take your break. 40-second break here. And then we're going to dive right into our final minute in the frontal plane. So as you're taking this break, think about what you could improve on. There's always things that we can improve on. So you've got another 15 seconds here. You may want to get set up if that band's not on. It's a little jarring to have to do it quickly. Okay, just 10 seconds more. Less than 10 seconds now. Get set up. Counting you in. 3, 2, and here we go. 100% effort. 1 minute on the clock. Please give me all you got. Use your breath wisely. Watch out for the chin. I always see this forward head syndrome with sway back posture or the chin dropping and typically neck issues in the neck extensors. So if we can learn that our head is a part of our spine and it should sit right on the top of the spine and the chin needs to lift, the front of the neck needs to engage, and our gaze must stay higher than eye level. So as you do a cardio burst, you need to follow the wall or follow, something on your wall, have a focus point that's higher than eye level. Keep breathing into that. You're doing great. Hang in there. Push yourself. 10 seconds to go. Give it all you got. Go hard. Breathing. 5, 4, 3, 2, take your break. A 40-second break. While you're taking the break, I'm going to put the blue loop band on, and you may want to start to put the bands on because, it takes a second. And the green Theraband, I'm going to come into my serve the platter, throwing it over my shoulder blades, wrapping it around the knuckles with the thumb on the outside. I'm going to show both variations. I'll inhale, prepare. Exhale, 8 scissor legs from 12 o'clock to 3 o'clock, and 4 reverse lunges. This is our normal one. And if you have any back issues, and there's no problem if you do, we're going to keep you safe. You can do your leg reaches, and then you can move into the reverse lunges. Knee issues, stay with the leg reaches the entire time. Counting you in. 5, 4, 3, 2, here we go. 100% effort. Please give me all you got. Work on your form as you're doing this. No leaning forward. Imagine those back ribs pushing into that green Theraband. It's there for a reason. Get you out of the front of the shoulders and pecs and into your upper back. Plug the shoulders down, gaze up higher than eye level. Keep puffing the back ribs into that green band the entire time. Your back should be exhausted by the end of this. You'll know you worked it efficiently if it is. This is all about the back and your glutes, your butt muscles here. Brace your abs. Lift in and up on the muscles that stop your stream of pee. Whatever variation you're doing, commit to the breathing. Inhale to prepare. Exhale to move with the internal abs, the muscles that stop your stream of pee, lifting in and up, contracting them to contract your transverse abdominis. Just 10 seconds. Push yourself. Focus on your form. 5, 4, 3, 2, 1. 40 seconds here. Take your 40-second break. Grab water. Just don't sit down. Any stretch you need to take, maybe your back's exhausted, maybe you need an upper back release. Show you the serratus anterior one, elbows to chest. Lift the elbows up and down. And that's a nice release. We have 20 seconds. If it takes you a while to get set up, you better get set up now. Blue loop band around the thighs, green Theraband around the back, and our serve the platter arms. 10 seconds. Final set in the transverse plane. Counting you in. 5, 4, 3, 2, here we go. 100% effort. 1 minute on the clock. How hard can you go? How much can you give me? No joint pain. Brace your abs. No leaning forward. Bones of the big toes. They're going to help you out. Push into them. We're going to combat that supination in the feet. Lift your chin. Gaze is soft. Collarbone is wide. Imagine my hands. They're constantly hovering from your shoulder blades. Puff your shoulder blades and back ribs into, well, you've got the green band there. Keep puffing the back ribs into that green band. Back ribs into the green band. Stay focused on that. Really important. You're doing great. The reverse lunges. Make sure the knee's tracking safely by pushing heavy into the bone of the big toe. You don't need to look down. 15 seconds to go. Focus up. Chin lifted. Neutral pelvis. So try to not round your low back. Keep it neutral, somewhere between arching and rounding. Give me all you got. Counting you down. 5, 4, 3, 2, 1. Please take your 40-second break while you're doing it. I'm going to set all the bands to the side and demo our sagittal plane. You don't need to do it. Just watch. I do our cross punches for 8, 7, 6, 5, 4, 3, 2, 1. The 4 oblique crunches at the top on one side. And then I do the cross punches back with the leg reaches. You have 15 seconds. And then on the other side, I do the 4 oblique crunches, setting up, counting you in. Here we go. 5, 4, 3, 2, 1. 100% effort. First minute in the sagittal plane. Give it all you got. Push yourself. Use your breath. Think about your form as you're working. Are you using your abs? Is your belly in? Are you lifting up on the muscles that stop your stream of pee? As you do those cross punches, are the legs reaching? Same leg as arm, that the punch crosses the body, but it's the same arm and leg that are one's extending and the arm is twisting and punching in opposition to the leg reach. So it should feel natural once you get going. And the oblique crunches, your supporting knee must be bent, knee soft, tailbone back, chin lifted. Keep breathing. Push yourself. Another 15 seconds. Another 10 seconds. Give it all you got. Hang in there. And 5, 4, 3, 2, 1. Take your 40-second break. We got 40 seconds on the clock before our final minute in the sagittal plane. Take any stretch you need. Grab water. Remember your 8 cups a day if weight loss is a goal. Always have water by you. Never more than 10 bites of food without following it up with 10 sips of water. That's my goal, especially when I have something not so healthy in front of me. That way I eat way less, portion control to maintain optimum weight. Okay, brace your abs. You got 10 seconds before we do our final burst. Counting you in. 5, 4, 3, 2, here we go. Please give me 100% effort. This is it. You're done after this. Remember, cardio bursting is the most time-efficient way to condition your heart. And as you move through progressions, your recovery times are going to decrease. So that means your heart is getting conditioned very deeply so that you're able to get it to resting and then spike it up. And this helps with stress and anxiety management. So by level 5, you'll only have 20-second recoveries, just 20 seconds before you begin again at 100% effort. The National Heart Association recommends 3 of these a week. So you have done 1, mark your calendar, just 2 more a week. And we have variety. 20 seconds. We've got stair stepping, which is actually in the postnatal and is great for anybody that wants to do stair stepper for their glutes. And then we also have a series that is for chronic back and joint pain that's great for everybody as well. Counting you down. 5, 4, 3, 2, 1. Another series we have, you can stop, is on a trampoline, and that can also be done using a jump rope. So we have many variations if you want to keep changing it up so that you're not doing the same burst. But remember to try to work through the levels. And if you stay with this burst until you're doing it very efficiently, then you'll work your way through the ranks, conditioning the heart. Excellent job.